Phacoemulsification is a commonly performed surgical technique for cataract removal, using the ultrasonic energy to break up the cloudy lens and aspirate the fragments. While phacoemulsification is generally considered safe and effective, tip fracture during the procedure is a rare but recognized complication. In the described case, I encountered a fracture of the phacoprobe needle during the emulsification of a hard dense cataract. This fracture was characterized by a sudden loss of aspiration, altered ultrasound energy transmission, changes in the effectiveness of emulsification, and abnormal vibrations, initially mishandling of the titanium needle and loose tightening of the phacotip I considered as possible causes. However, upon examination and testing of the tip after removal from the anterior chamber, an unexpected fracture was observed in the needle away from the ABS aspiration bypass system microhole. Mishandling the phacotip with improper tightening is a potential cause of tip fracture. Inadequate tightening of the tip can lead to instability and increased stress on the needle, making it more susceptible to fracture, especially if very hard cataract. Surgeons must ensure that the components are securely fastened to minimize the risk of tip fracture. While this case report highlights mishandling as a potential cause, it is important to note that the literature on phacoemulsification tip fracture is limited, with only a few reported cases. Excessive mechanical stress applied to the tip, especially when dealing with hard-roped cataracts, is identified as another cause. The dense nature of the cataract can require increased force during emulsification, potentially leading to tip fracture. Other factors that may contribute to tip fracture include incorrect assembly of the tip, material fatigue from repeated use, and poor material quality with manufacturing defects. These factors can weaken the structural integrity of the tip, making it more prone to fracture. Tip fracture during phacoemulsification is a significant concern due to the potential intraoperative complications it can cause. Fractured tip fragments may dislodge and cause damage to the delicate intraocular structures such as the cornea, iris, or posterior capsule. Surgeons must be vigilant in recognizing the signs of tip fracture, such as changes in aspiration, altered energy transmission, and abnormal vibrations or noises, to promptly address the situation and ensure patient safety. To prevent tip fractures, surgeons should adhere to proper handling techniques, including appropriate tightening and assembly of the tip, using high-quality phacoemulsification instruments, and avoiding excessive force during emulsification can also help minimize the risk. Thank you for watching.